So last week, Quebec announced almost $1 million in funding for a new pilot project. The intention is to improve access to healthcare for English speakers. And the idea is to have what they're calling patient navigators, who will serve kind of like a liaison between English-speaking Quebecers and health providers. It's going to be in 9 regions across Quebec. Not, however, in Montreal. Paul Brunet is a patient's right advocate, and he joins us on the line. Good afternoon, Paul.
Good afternoon.
So what do you know about how, like, the idea behind these patient advocates? How will it work?
Well, I'm not aware of, all the details. What I understand is that the system wants to be a more friendly user for Anglophones patients, which is a good thing, because I've gotten a few complaints from Anglophones who have tried to work with all the French obligated, data and system and access, and I think it's going to help them. I hope, and I can't wait to have Montreal included in the project eventually.
Yeah, what do you think about that? That there is no that they're not doing it in Montreal. Why do you think that is?
I don't know. I mean, maybe they're trying, like a pilot project elsewhere in Quebec, but normally a pilot project, is in a small community somewhere in the province. But now it's all over the province except Montreal. So I don't understand the reason behind that, unfortunately. But, we want to believe and understand that if this app will render more efficient and have Anglophone patients have a better access to healthcare, that's certainly a good thing. I just wonder,
Yeah.
When you have access in English, are you going to be treated better and faster? I don't know. I hope so, because we all deserve to be treated faster and in a more efficient way. We pay a lot of income tax, but I don't know what's going to happen with the project, and I don't even know why they're not doing it in Montreal.
Well, I mean, I suppose it's because we technically have English hospitals here in Montreal, and I suppose that there is access to health services in English in Montreal. I mean, perhaps it's more difficult in the regions. Is that something that you've heard from patients?
Maybe. No, I haven't heard anything from the patients in the regions. But, I mean, you're throwing a few apps for Anglophones, and some apps which are bilingual, like OPAL, used to be working at MUHC. It was canceled.
Right.
Was abrogated and was very important for cancer patients. So, you start new apps, but you cancel some apps that were already working for both languages and patients who really appreciate it. So sometimes you tend to ask questions, why do you want to go for new stuff when you're already cutting on stuff that was working already? I don't know. We need to see. And Santé Québec is trying a lot of things, and I just want the system to become more efficient, more accessible to patients. If Santé Québec cannot do that, well, I don't know what they're doing there. If the minister was so glad to announce the new Santé Québec corporation.
Yeah, well, I feel that, it's not often that you hear announcements about the English community. And, there were a couple in the last month. One was about including the English community in the Constitution and this sort of patient navigator. So I don't know. I mean, is this, you are a patient rights advocate. Is this something that you've heard from patients that they, English-speaking patients that they want?
Well, I know that some English patients that call us and need to be supported, having access with, having problem with accessing in English some services. There are 2 priorities and 2 principles. Any English or French patient should have access, be understood by the medical or nursing caregivers, and be able to understand. If they don't do that, well, we have a problem. And already there's some problems in some places, some hospitals. It's not some CHSLD. And that's what we're not a language rights advocate. We are a patient's rights.
Yes.
So anywhere we can push on the system so that the patient be able to be understood and be able to understand, of course, we'll fight for them.
So, I mean, you mentioned just a minute ago that you're basically, or your overall hope is for Santé Québec to be more accessible to patients overall, not just Anglophone patients. What do you mean by that? What are some of the problems that you see in the system?
Well, reduce the waiting time, waiting days, waiting months for surgery, waiting time for a bed in long-term facility, waiting time to access psychological and psychosocial care. So many people are in surgery. I just said it. So many people. This is a record high of people waiting across all the waiting list. I mean, we have to do something, and I wonder why we don't ask the private, being paid by the public. Some doctors some surgeons working in private clinics who we could have an accord with and be able to reduce the waiting time and the list of patients waiting for surgery. Why don't we do that? Unless we have a budget limitation. It's just certainly understandable. But what is not understandable is that patients with the income taxes they pay every year, they don't have access. This is scandalous in my mind anyway.
Mm-hmm. Well, I mean, there are, of course, some disciplines where you can go to either, private or public. But, the idea of an advocate and this kind of patient navigator is supposed to be an advocate for the patients. I've been talking to a few people that have been having to navigate the healthcare system recently. It strikes me that every patient could really use like a navigator, to help them, whether they speak English or French or any other of the many languages that we know are spoken in the province, because it can be super confusing sometimes to have access to services, especially if you don't have a GP.
And I save you the fact that at least 20% of our elders or very sick are not familiar with internet and want to be able to call, have a phone number, which is not necessarily available, or it takes, like 811 takes so much time sometimes that it's ridiculous. So people hang up and end up at an emergency ward. We need to become more efficient. Everybody knows that. Everybody agrees with it. But, I mean, I hope, and I still give them another year to Santé Quebec to make it even more efficient. There is no reason why, that we just saw this new platform of Santé Quebec where they tell you that you're going to wait some hours or maybe 24 hours on a stretch. This is unacceptable. What are we doing? I thought we had a system that wanted to become more efficient, and supposedly Santé Quebec is supposed to do the job. So I still hope that they do, because if they don't, I don't know what we'll have to do at the end.
Well, I feel like you've been in this business a long time, and I've been in this business a long time, and I can remember at least a half a dozen attempts to make the system more successful, including complete reimaginings of the system and breakdowns of existing structures. And from what you're saying, it's not really working.
My brother, who founded the association, Claude Brunet, 1974. We started this association. In 1985, he posted a letter, opinion letter from citizen in La Presse, 1985, praying the government to render the system more efficient so that people wait less at emergency ward.
Wow.
1985.
Yeah. Mm-hmm.
I'm sorry.
Yeah. I mean, listen, I wouldn't want that job.
Me neither.
It's a complex system.
And you know why we didn't want it? Like most of the doctors and nurses who leave, because it's too complicated for them to work in the public system.
Yeah.
Would you believe this?
Yeah, of course.
Not even a matter of money anymore.
No. All right. Well, listen, thanks so much. It's always great talking to you, Paul.
Take good care.
Bye-bye.
Hello, Canada.
This is Bryan Adams Radio. Hosted by Bryan Adams himself.
We'll play a few of mine, a ton of my favorites, and some must-hear behind-the-scenes stories from the world of rock and roll.
Coming to get you!
One thing about doing rock and roll so long is you end up meeting a lot of the people that you admire. Sometimes you even get to work with them.
It's only love, and that's all. Bryan Adams Radio. I'm coming back to you. Now available on the free iHeartRadio app.
Hey everybody, how are you tonight? Sounds great.